The following is my opinion and is not intended to represent nor presented as the opinions of the members of this community. There is a lot of misinformed comments and conversations on one of our Delphi sister subs regarding the grieving process and how, exactly, one is expected to grieve as a human being. Conventional thought on how a person should grieve was once presented as 5 separate stages. Stage 1. Denial. Stage 2. Anger. Stage 3. Bargaining. Stage 4. Depression. Stage 5. Acceptance. And while these 5 stages of grief still serve as a general blueprint for how humans grieve, newer research reminds us to keep the following in mind. 1. Grief is not linear. No one starts and ends at each level of grief, and you may move backwards, then forwards, then backwards again. That's okay and it's normal. Point 2. You may not know where you are in your grieving process, or you may be between stages. 3. Grief is a lonely process, but the burden can be a shared experience. In other words, there is no proper or acceptable way to grieve. The stages are fluid, do not have to occur in order, and one does not attain the next stage after finishing the previous. This holds true, especially in traumatic grief, which, for the purposes of this discussion, I will assume KG experiences. While there's not a time limit to grief, traumatic grief can significantly impact your mental, emotional, and physical health. According to Collective Behavioral Health and verified by psychiatrist S. Greensberg, MD, the symptoms of traumatic grief are 1. Difficulty functioning or doing things needed to get through a typical day. 2. Struggling to recall anything positive, especially about the person they lost. 3. Difficulty thinking about anyone else. 4. Experiences of physical pain in the same areas as the person who died. 5. Avoid reminders of the person's death. 6. Cannot accept their loved one's death. 7. Feeling stunned or dazed by the death they're grieving. 8. Longing for the presence of their loved one who died. 9. Feeling as if their life is empty without them, like there is no point in living without their loved one. 10. Seeing their deceased loved one or hear their voice. 11. Fixation on going where their loved one went or doing things they did. 12. Feeling very angry or bitter about the death of their loved one to the point it makes them jealous, suspicious, or envious of people around them. 13. A constant feeling of loneliness. Addressing traumatic grief is important because it's a mental health condition that actually prevents healthy grieving. Severe, prolonged traumatic grief can also impact physical health. Sufferers are 1. Likely not able to fully focus on meeting responsibilities. 2. Have difficulty taking care of basic needs. 3. Experience memory loss. 4. Are exposed to false memory. As a result, sufferers may feel drained, exhausted, have trouble eating or sleeping, and show other signs of physical illness. Additionally, it is not out of the range of possibilities that KG is suffering from post-traumatic stress disorder. PTSD can cause many disturbances in memory functioning and could easily explain her detractors' insistence of inconsistencies. Trigger warning. Discussion of combat, child abuse, sexual violence, Holocaust and anti-Semitism. Multiple studies have demonstrated verbal declarative memory deficits related to PTSD in samples of adult patients with PTSD related to combat, childhood abuse, rape, political violence, and the Holocaust. K. Samuelson, MD, took this research and determined that in non-adult brains, our brains do not fully mature until age 26. KG had a non-adult brain at this time. The verbal declarative memory deficits also applied. 1. To children exposed to intimate partner violence. 2. To children in motor vehicle accidents. 3. To children who are physically abused. 4. To children who are sexually abused. 5 to children who manifest survivor's guilt. And GT, survivor guilt is a mental condition that occurs when a person believes they have done something wrong by surviving a traumatic or tragic event when others did not. The experience and manifestation of survivor's guilt will depend on an individual's psychological profile. Granted, in defending KG about inconsistencies, I have had to make reasonable assumptions regarding her possible suffering of traumatic grief, PTSD and memory loss. But I believe these reasonable assumptions offer a much more realistic picture of tragedy and loss as opposed to the assumption that she offered her sister and her sister's best friend as a sacrifice to the dark web. Oops, I mean a more realistic assumption regarding her inconsistencies.